My name is Kathy Fontenot. I'm a physician, a primary care physician, general internist, and geriatrician actually by training. I am on the faculty at the LSU School of Medicine, and I've been medical director of the Musicians Clinic here in New Orleans since 1997 when we did our initial needs assessment. Actually began offering services in 1998. One of the greatest things about the Musicians Clinic is that although we serve as primarily a primary care clinic, and we have a nurse practitioner and myself, a primary care doc, who take care of the primary care needs of the patient, when there are specialty needs that are identified, for instance, if a patient needs access to a cardiologist, or a patient needs access to a kidney specialist, or a cancer doctor, or things other than primary care, we have access to those caregivers as well, to those providers, many of whom are from LSU, the School of Medicine at LSU, many of whom are from the Tulane School of Medicine, and even better, I think, and probably one of the closest and most important affiliations is that we do have access to the Medical Center of Louisiana, formerly known as Charity Hospital.
The good thing about the Musicians Clinic is I can really spend time with the patient, and each visit is 45 minutes, and I really take time to assess everything that is needed because I don't know when they're going to come back. So I do the maximum I can when they're here. So we talk, of course the work is a big part of the visit, what they do, and we really include it's the whole person, it's the family, it's we see the patient's wife or partner, and sometimes children, so it's the whole person that we take care of. So that takes time, and we have counselors. There's a lot of anxiety and depression that are included in the visits. So it's physical, emotional. We take care of the whole person.
The Boltmans were really the most active in the community, and said, let's put together a group. We can get the right people around the table, sort of brainstorm about some things. It, as I recall, was shortly before Jazz Fest, actually, in 1997. And so, of course, none of us had done this before, and said, gee, what's different about musicians? Do we really need to do this? And we said, well, let's ask the musicians what they need. We all had ideas about what we thought the musicians needed. And then we said, Jazz Fest is coming up. How could we maybe put something in their paychecks or pay stubs, or get some survey done, because musicians, as most people are not great about filling out surveys. But we wanted to know from the musicians themselves, what is it that you need? What's different about you? Do you need health care, or is this something that is already taken care of? We have a great charity hospital here in the city that caters to all people, regardless of ability to pay. But this wasn't intended to be a hospital sort of thing. We didn't want patients just to come to us when they were sick. We wanted them to come to us to stay healthy and avoid illness.
It's really difficult for musicians. They really live day by day, week by week, and if there's a hurricane like Gustav recently, they lose a week of gigs. It's a big deal, and so luckily, thanks to Bethany, we're keeping the copay to $10, and that makes a big difference. When they have to pay $25, they're thinking twice about walking in or making an appointment. So $10, that's a great thing, and we've been having a lot of more patients recently, just thanks to the copay.
Since Katrina, the population that we serve is increasingly unemployed or underemployed, certainly uninsured, or more so than before, increasing difficulty getting gigs, getting jobs, and therefore increasing difficulty in getting prescription medications, which of course are necessary for many folks to remain healthy and stay out of the hospital. The mental health issues are just as important and valid and worse in the musician group as is in the rest of the New Orleans population. It's no secret that the mental health needs have grown extensively since the hurricane struck here because people were just devastated. You know, their lives were just in disarray. Many lost their belongings, their instruments, their homes, their jobs. Many had to evacuate and figure out a way to survive until they could get back home if there was even a home to come to. And so I would think that probably in my mind the mental health needs have increased fairly dramatically since the storm.
They really try hard, and we're having good successes, and for some people it's harder than others, but they're good patients.
But we really want patients before they get sick. We want to know what their blood pressures are. We want them to know what their cholesterols are. We want them to get checked for diabetes long before they develop any symptoms. And so the challenge is musicians are, they're not, if they're feeling okay, unless it's interfering with their gigs or their ability to earn a living, they just sort of ignore little nagging things. And certainly if they don't have any symptoms at all, why take the time? Our hours are different and my schedule's busy, and why take the time to go in for a preventive visit? And so we need to impress upon people that we want to see them when they're healthy. They don't need to be sick when they come to see us. We want to prevent disease or anticipate disease and treat it before it ends them up in the emergency room.